Hey everyone, I'm Lauren Fleming, the founder of Him Supportwear, and today I have Caitlin Oliveros with us. She is the founder of Studio Duyon, physical therapy and wellness in Woodland Hills in Calabasas. She's a licensed physical therapist, certified Pilates instructor, and meditation teacher. Her areas of expertise include pelvic health, scoliosis through the Schroth method, and hypermobility or Ehlers-Danlos syndrome. Her experiences with chronic conditions inspired her to create a safe space for individuals to receive honest, intentional, and effective care. Caitlin, we're so excited to have you here talking with us today.
Thank you for inviting me as well.
All right, I'd love to just jump right in and have you tell us a little bit about your background and what inspired you to become a physical therapist.
Sure. So I actually come from a background of medical professionals. So it was almost natural for me to follow that route. But unlike my other relatives, I really wanted to work specifically with women. I just find that we're a whole other beast. We've got our own issues that are very unique and very complex and forever evolving. So I definitely wanted to work with people who were really active in trying to improve their condition, but also even after that, I feel like women are super resilient. So they don't just want the recovery, they want to keep going, keep the results lasting, and just really reclaim their life and take ownership over their life. So that's what led me to become a pelvic floor therapist. But I myself, I have PCOS and I also deal with intermittent pelvic pain. So kind of in a way, I was also inspired to help myself
Mhm.
at the same time. So that's where I got started as a pelvic floor PT.
Great. Thank you so much for sharing that. Will you tell us a little bit about what a typical day looks like for you in your practice?
Yeah, I have a routine, and it might be because I have pretty high functioning ADHD. I'm sure a lot of women can relate,
Hmm.
but I do the same thing. So I come in, I tidy up, I turn on my diffuser and some music, and I kind of just give myself at least 10 minutes of alone time. I'm very big on meditation, boundaries, so I take a moment of gratitude to just thank my space for allowing me to have this area to help people heal, but also it serves as my bread and butter. So I always make sure that I start my day with gratitude so that I also have a clean slate ahead of me.
Hmm.
But when I have some extra downtime, I have a reformer here. So I hop on the reformer or I'll
Nice.
stretch a little bit, squeeze in some movement before the busy day because otherwise I'm just gonna have to buckle up for the ride and my day it just flies by.
Yeah. Yeah, I hear you on that one. Great. Thanks for sharing that. Um, One thing I like to ask when I talk to different folks is how do you explain the importance of pelvic health if you're talking to somebody that maybe either knows just a little bit or maybe even hasn't heard about it before?
Hmm. I mean, like anything that's new, I explain what it is. I have to mention what the pelvic floor is. It's muscles, connective tissues that support our organs and bodily functions like reproductive health, peeing and pooping. But I also like sprinkle a little bit of humor in it. I just find that when people are dealing with problems in their life or changes that they don't expect or don't want in their life, sometimes lightening up the mood can be helpful. So I'll introduce myself as a pelvic floor PT and I say, I help zip up your core, I help you laugh without leaking, and I help you get laid without pain. Um, so that's one way that I kind of explain it. But like an actual patient, I really try to explain that pelvic floor therapy or pelvic health is it's almost a really intimate relationship between patient and provider. It's unlike other types of physical therapy out there, which can it's not as personable because with pelvic health, I re like the provider really needs to know your story and why you're coming in to seek care and what you're hoping to expect after the care is completed. Um, because it is kind of life-changing, and for a lot of women, it can be long term. So to be understanding is like another big part of explaining what pelvic floor therapy is. Um, but I find that sharing the stories is more. effective in explaining what pelvic floor therapy is than giving them an anatomy lesson, in my opinion.
No, I think that's great. And I think it's helpful to hear you talk about it that way because from what I've seen and experienced personally, like it is such personal issues that people can be experiencing when they're seeking pelvic floor care or pelvic health and pelvic floor physical therapy. So I think hearing about it in that way from you, I think can be really helpful for folks because I don't know. I think for me and what I'm seeing, I think it's kind of different to other um, support that people can receive in the healthcare community in an amazing way, in the sense that it's very one-on-one. It's very much like the people who are working in this space are, they want to help you. They have the time to listen to you and really get to know like your whole story versus like, okay, tell me the symptom you're trying to address and we'll quickly, work on it and kind of move you along. And so I think in that way, it's really like stand out in the healthcare community.
Oh, yeah.
Yeah, and so impactful, especially when it's such, this like intricate part of like your whole body system and can impact so many things you don't even know about. So
Exactly. Yeah.
yeah, that's great. Um, One thing that I feel like I've seen a lot is a lot of myths or misconceptions around pelvic health, especially as I think we're seeing it talked about more and more in the last few years. What are some of the kind of major ones that jump out at you as the biggest ones or the ones that you feel like we need to talk the most about to be like, hey, that's not true?
I mean, you can already see me. I'm ready to talk about it. And I would be surprised if you haven't heard it, but Kegels.
Hmm.
So I feel like Kegels are being treated as this, um, I don't even know, like a generic pill when it's
Yeah.
really like should be treated as a prescription medication. A lot of people think that regardless of what they're going through, constipation, pelvic pain, prolapse, um, whatever the case may be, that Kegels will solve all of that, which it's not Windex. That's a reference. Sorry, I just it's a reference to my big fat Greek wedding. But yeah, it's not Windex that you just spray it on like the dad in the scene. It doesn't solve everything. I think that it's safe and effective for some people, and it must be prescribed by a pelvic floor expert who will instruct you on how to do it specifically for your condition and for your body. I've been surprised that a popular brand, I think a few years ago, um, said like something in the promotion about how everyone should do Kegels. And that just tells me that this brand that a lot of women buy from and trust is able to say something like that and add on to the misconception and the myths. I think then there's still an issue about debunking that it's not the solution to everything. It's very, it pelvic floor is more than Kegels. It's a lot of things. It's lifestyle modifications, it's diet modifications, it's about how you sleep, how you react to intimacy, it's how you hold your trauma in your body. There's just so much more to pelvic health than a lot of people think, and Kegels is just one tiny aspect of it.
Yeah, I feel like that's a great one because I think to that point, one of the things folks don't often understand is like how your pelvic floor, some of your symptoms could be from laxity and lack of strength, but then also it could be due to tension and that you can't relax. And so those folks doing Kegels, it exacerbates the problem. But
Exactly.
when people don't really understand how that works and understand what's going on with their own body, they may be doing something that has been advertised as great for everyone, and it turns out that it's only making things worse for them, and then they have to go undo all this hard work that they've been doing. Um, yeah, so and I do think that companies have this real responsibility, to make statements and put things out there that are true, and it's really unfortunate when, for advertising that isn't the case.
I mean, with hem support wear, like what I loved about it is that even your tagline says that you're thoughtful. And so receiving your product, I've actually seen I'm was talking to one of the ladies through email before actually connecting with
Mhm.
you. And the reason I was even on here is because I sent you guys a message about your product and how I liked it, but not just that, it was the service and the thoughtfulness. You even provided us like this beautiful letter and care package along with it. Um, But yeah, I feel like everything has to have intention behind it. And so same with Kegels, it's like,
Yeah.
what's the intention behind that? Everything that anyone should do should be rooted in intention. Otherwise, there's no real purpose, and it, it's it's just there to be a filler that doesn't sit right with me.
Yeah. Yeah. No, I think that's a great one and really important for people to hear, especially if, just to increase their education of how it all works. And then maybe Kegels are right for you, but maybe they're
Yeah.
not. And there's other things that can be really helpful
Yep.
if you're having symptoms. Yeah, that's a really good one. So I know, pelvic health and, talking about these is it one of the things I love about it is how it is such an individualized approach. But at the same time, there are some general things that can apply, to all types of bodies. Will you talk a little bit about, if somebody's wanting to know, okay, how could I, start to improve my pelvic health today? What are some easy things that we could adopt into day-to-day practice just
Mhm.
for good pelvic health in general?
Right. So, I mean, I'm a big advocate for just breath work in general. So you could take that literally breathing as the action, but also figuratively as in resting and relaxing. Either way, the concept still remains the same, but the physical aspect of having intentional, or I should say, carving time for intentional breaths is so important for anyone, regardless of what they're going through, because it allows you to have a reset in your body. So a clear mind will allow you to have a healthy body. And so I like kind of like how I start my day with that little intention and that little time of gratitude. I make sure I work in some breath work at that time because before I can see my patients or before I can start doing errands or go on a jog or whatever, I want to make sure, again, coming back to intention, that I know what I am about to do, I know why I'm doing it, and I should feel good about doing it. And so, with a lot of women dealing with pelvic issues, sometimes taking that step back could actually reveal a lot. So a lot of my patients who I have to teach that to, because a lot of us hold tension and are super stressed and busy moms, um, they realize that in those few minutes of breath work, intentional time just on their own, that they can actually tackle a lot of these seemingly impossible tasks that they have to do, or these seemingly impossible, let's say, health challenges that have come their way. It's just a matter of perspective, and we just have to make them bite-sized. Um, and yeah, the breath will reveal that. And physically, it's so good for you. Vagus nerve stimulation, down training, relaxing that nervous system, and releasing your muscles even. So the breath is really powerful.
I think I really like to hear that, especially because I think, a lot of people who are first kind of getting introduced to pelvic health, a lot of times that's after having kids. Maybe it's their first kid or multiple. And it's at a time in your life when the mental load of all of that is for most people more than they've ever had in their whole life. And it can be challenging to take that time to pause and rest and reflect. And so I think when you incorporate the breath work like that, it can really help you to pause and take that inventory of what is going on in my mind and body and how am I really feeling? And yeah, I just think it to the exactly what you said, it can be just such a powerful tool and seemingly simple. And there, of course, there's a lot to it, but definitely one we could all take away and start today. So thanks for sharing that. Will you tell us a little bit about kind of like I was saying, I think a lot of people get introduced to pelvic floor physical therapy during pregnancy and postpartum, but I know people who are not pregnant or postpartum can benefit from pelvic health as you progress through the different stages of life. Will you just talk a little bit about how pelvic health and working with someone like a pelvic floor physical therapist can come into play at those various life stages?
Oh, yeah. I mean, you're right. A lot of the women that come in to see me are moms or moms to be. So, in prenatal stages, it's all about labor and delivery prep, support to avoid any pelvic symptoms that may happen in postpartum. And so, in postpartum, a lot of things that we might see is the abdominal separation, prolapse, feeling like the organs are going to fall out, leaking. But even past that, thinking of menopause, there could be more dryness. So maybe having intercourse is a little painful or difficult, or even more exacerbated prolapse symptoms of that pelvic weakness. But even if you are not a mom or you don't intend to bear children, I just find that all people, men, women, everyone, can benefit from pelvic floor PT because there's a lot to it than just that area.
Mhm.
Um, like I myself, I mentioned that I deal with some pelvic pain, but sometimes that pelvic pain isn't felt in the pelvis. I've felt it go through my leg down to my toe, found the root issue to be in the pelvis. So it's just better to just be aware of what's causing some of the things that are happening to you, especially pain, tightness. But I also feel that just being connected to the pelvic floor has unlocked for a lot of people a type of strength and stability that they have been looking for. So I see a lot of active or even athletic patients who struggle with the lower belly pooch, or they say that they've been doing Pilates class or a bar class or whatever for years, but still something is missing. And when they connect to the pelvic floor and core, they finally feel that strong sense of stability that they've been searching for. It's very intuitive. I feel that once you are aware of what the pelvic floor is, what pelvic therapy is like, you realize that you may or may not need it. But I feel like most people will benefit from it regardless. It should be the new gym, I think. Like, I feel like health should be a gym. People should come to PT, OT, mental therapy, everything, just like for a more holistic approach to self-care. It
Mhm.
is self-care.
Yeah, absolutely. Well, and I think to, your point of, feeling pelvic pain in other places, but then it being that root cause. I mean, I think a lot of people in their, over the course of their life, they've got like aches and pains and things that are bothering them. And I think if we could, move things in a way where it does become the standard of care and it is routine and it's more proactive versus reactive. Um, I think that would just be better for everyone because it's so connected, and then it takes up so much mental space when you aren't feeling 100%. And so that it just is this like, yeah, this, I don't know, vicious cycle if you can't, get the care and do the work that you need to do. So yeah, I think the more we can shift things that way, the better for sure.
I feel like pelvic health is so taboo because it's a
It
lot of
is.
it is found to be embarrassing, maybe
Hmm.
even shameful. Um, Intimacy is also hard to talk about, even to for some people to their own partner. And
Right.
there's a lot of problems that can be not just uncovered, but resolved through pelvic health in that way. I just feel like making it normal, aiming
Hmm.
for that normalcy by
Yeah.
talking about it, like even this podcast or even this interview, it's a
Yeah.
great way to just inform and educate people and yeah, let's make it that standard,
Yeah.
just common.
Right. Well, and really keeping, I feel like too, like when folks are talking about it, like really keeping that an open mind, an open perspective. I mean, I remember I was at a women's wellness like business like networking event where it was women founders with companies that were supporting women's health and wellness. And we were just, I was chatting with a couple of the founders before their talk, and I was talking to them about him support wear and what I worked on. And it was so interesting because the discussion around whether or not they saw a pelvic floor physical therapist was coming from, well, I didn't need that and I didn't have to do it. Like, oh, it was almost like they did well because they didn't need it. And I was like, God, it's really disappointing that in that conversation was the stigma. Like my perspective was I was so thankful that I had the connections and resources to be able to seek that care. I wish that it was available for everyone in that way. And I wish it wasn't like a badge of honor that you don't need it. And it was eye-opening to me, having that conversation. And that's kind of the needle I feel like, we're working to shift.
Yeah.
Will you talk a little bit about what you find is like the most rewarding aspect of your work?
I think it's definitely, I mean, I don't want to say I have favorites, but working with prenatal populations is really rewarding because I see them through their pregnancy, through postpartum, and get to meet the little seed that was just in their belly. I
Mhm.
think that's the most rewarding. And when they bring them in, it's like, whoa, I can't believe that I'm actually meeting you and that, that was a part of my patient's journey. And
Mhm.
um, seeing them feel that, like when you see them glow when they come in and they're like, this is what I'm coming in with. Like, this is my pride and
Uh-huh.
joy. Like, this is what I worked so hard on. I think that's the most fulfilling part. But like everybody's success stories, I love it when people have a shift in perspective too, when I see that light bulb in their head and they're like, wow, this is really good for me and this is actually like something I needed. Like, I love seeing that too.
Yeah,
My
that's great.
patients' wins are my wins.
Yes, for sure. Speaking of wins and success stories, do you have a success story that you would feel comfortable sharing with us?
Hmm. Yeah, I was actually just thinking about a patient I had a while ago, just crossed my mind. I think I saw her Instagram, that's why. But she came to me after college from a very conservative family, but still was brave enough to talk to her parents about needing pelvic health, really advocated for herself, which at a young age I really admired.
Hmm.
She was dealing with dyspareunia, having difficulty with any sort of penetration or insertion. Unfortunately, came to me after her ex, I should say, broke up with her because of resistance to intimacy.
Hmm.
I mean, it was something that was painful. She can't even consider
Hmm.
having sex with him at all, and unfortunately broke her heart because of that. I remember her asking me, "Will I ever have a normal relationship?" Which, as a pelvic floor PT, it's like, how do I respond to that?
Yeah.
And I felt for her. She was very young. But yeah, just recently I saw her Instagram and she is engaged to someone else. And I mean, in between that, because she had been discharged, I would always check on her, ask her how she's doing. She always thanked me for the pelvic health PT. Said that she never imagined that she could even insert a tampon back then and was able to have sex now without pain. So maybe children in the future too. So just seeing my patients grow is insane. And it's something that just tells you how important it is. Like it could really change the direction of someone's life. She was very, I guess, loss of hope to now she's like reaping all the benefits.
Thank you so much for sharing that. I love hearing stories like that, and I hope that folks listening, um, I don't know, I think they just instill hope because a lot of times people who are seeking help in for from a pelvic floor physical therapist, a lack of hope is often, I think, accompanies a lot of that. And even if they're not considering it yet, I think sometimes you can feel like there isn't any hope, or this is just how things are, or there's no option to change some of these major things within any kind of reasonable time or cost. And I think hearing about the work that you do and stories like that are really inspiring and impactful because it just shows going from so far from one end of the spectrum to the other is possible and people are doing it and there's people like yourself who are ready and willing to help and yeah, I just think hearing that is so helpful. So thank you for sharing that.
Well, thank you too. Thank you for highlighting all these experts. I think it's so important that we just continue to inform women and all sorts of people about what they're going through is not
Mhm.
the end all be all. There's definitely people out there who are willing to reach out. I mean, even hem support wear is such a niche thing. Like I've never seen a product with the hammock inside of it.
Yeah,
So like, yeah, people are there and they also have dealt with it and they're also making solutions because of what they're going through. So
right.
I think that it'll become normal the more we advocate for it.
I totally agree. One last thing I'd love to ask you about, just with you being a certified Pilates instructor and having the reformer in your studio, will you talk to us a little bit about like how you see this intersection of pelvic health and Pilates? Because I think we're starting to see that more. Pilates is, kind of having this big resurgence, and I would just love to hear your perspective on
Oh
that.
yeah. I mean, the reformer is really great as a feedback tool. So what I mean by that is although some of the things that pelvic floor PTs may do on the reformer are not exactly what you may see in a Pilates class, it can help you to refine your movement, connect with your pelvic floor for safer and more stable movement in your classes. But yeah, this crossover, I also have seen it. Um, I think that it's a great feedback tool because I find that when I put a client there, they're able to actually feel their pelvic floor lengthen or contract a little bit easier than if I had them do some exercise just using their body weight. Sometimes the extra resistance or the ability to stretch actually gives them more sensitive proprioception or sensation. So I've really liked how we can incorporate that into therapy. And also the clients enjoy it because they feel like they're in Pilates class and the carryover. So I think that's what makes it so great. It's we're already incorporating something in therapy that they probably already do or are interested in doing. So the effects of our sessions in physical therapy using the reformer or mat Pilates or just even the strategies they naturally, without us even having to remind them or to instruct them, they're already applying that in everyday situations. And so, yeah, I've just seen higher effectiveness through the reformer, and it makes pelvic PT less scary. In fact, people actually look forward to it. Or at least my patients look forward to it because they're like, oh yeah, I'm gonna have pelvic floor PT and I'm gonna be doing some workouts too. So grow that booty.
Yes, for sure. No, that's great. Thanks for sharing that because I'm starting to see that intersection more and more, and I think hearing about it is cool. And I think people who are interested in it will definitely, that will resonate.
Yes, I
Well,
agree.
as we wrap up, Caitlin, is there any kind of, last thoughts you'd like to leave us with as we wrap up the conversation?
Well, first of all, I just want to thank you. Well, it was amazing meeting you. Just receiving your product as well. Like it's been so great to show my patients and to have the comparison of different brands reaching out, but yours really stood out because I've honestly I've never seen it. It's just so nicely made, like high quality. I love all the details. It really is thoughtful. Everything about it is intentional, which is all, it's my jam. Intention is my jam. So I really enjoyed the product. The service feels like, honestly, it feels like friendship. The people that I was messaging with, it's like I know their name already. They know about me.
Kristen, yep,
So
she's great.
yeah, I am so all in for everything that you're doing. I'm also so thankful that you created this product and you created this brand. And not just that, you're reaching out to experts so that we can just serve our community better.
Yeah.
But yeah, that's pretty much it. Like, I'm just really appreciative that you invited me here.
Thank you, Caitlin. We really appreciate all of the stories and things that you shared with us today. We appreciate your time. Thank you so much.
Thank you as well.